Hello friends, welcome back to my channel. Today I am going to tell you regarding how to use 3-minute preparation time effectively in OET speaking. Well, in OET speaking, we get 3 minutes for preparing the role play card and after that 5 minutes to speak. Role play card is having three sections which consist of first is setting, second is background information and third is list of tasks. Not straight away go to task because these all the sections are important for OET speaking. First, I will tell you regarding the setting. So in setting, for instance, first is hospital ward. So with the help of setting, we can easily find out that it is a known case or an unknown case. For hospital ward, we can assess that high chances of known case is there. And in accident and emergency, the high chance is for unknown case. And in home visit, 50% chance is for known case and 50% is for unknown case. So from the setting, we can easily find out that is it a known case or an unknown case. And moreover, according to the situation, we can find out, we can use our tone. Like, is it a serious matter? In emergency and accidental case, there is a serious case. So we can speak with the patient or the bystander with that tone. And if there is normal patient is in the ward, we can use simple language. And along with this, there is a serious, we can again see that the case is serious, or we can speak seriously, or if there is any problem or patient is agitated, we can calm with that patient. Okay. So with the help of setting, we can also construct our self introduction. It is also helpful in our self introduction. So when we get a Q role play card, it is very important that in 3-minute time you can check what is the setting of the role play card. After that, second part of the role play card is the background information. Again, background information can be used like this. First of all, in background information, we can find that what is the role of the nurse. Like in some role play, there is mentioned that the nurse is a registered nurse or nurse manager or charge nurse or head nurse. After that, you can search regarding whom you are talking. Is it a patient or a bystander? Okay. So from this, we can also use the phrases beforehand in our mind. It is a brainstorming. Okay. Then next is a medical condition. So from the background information, we can also search medical condition, like the patient is having underwent colostomy and any other problems. Patient is having stroke, patient is coming for sample, and like this we can search the medical condition of the patient. Then is the reason for the visit. So reason for the visit, we can also search that what is mentioned in the background information. And at the last, we can also check the physical and mental status of the patient. As patient is anxious, nervous regarding his medical condition, so we can also find from the background information. So this is the second part of the role play card. And the third part is the task. So there is a list of tasks mentioned in role play card. So mainly role play card, these tasks are mainly to initiate the conversation. So in the task, there is mainly the verb mentioned in the sentences. So we can use these tasks for our better conversation. Okay. So these are all the settings and background information and list of task information. Okay. So now I am going to tell you overview of this OET speaking tips. Okay. The tips which we can use in for the 3 minute preparation time. So the first one is ask the interlocutor what to call him or her. So, well, guys, when we get a known case role play card, we can ask the name of the interlocutor beforehand and write in a that paper which we are given, okay, so that we cannot skip from our mind while doing our role play. So it is a very important point while doing role play in OET speaking, especially at the time of exam. Next is think about setting. As I already told you that setting is a very important. With the help of setting, we can find out which type of role play is it. It is a known case or unknown case. We can also construct our self introduction. Okay. So next is the understand the scenario. In this 3 minute, we can also understand the scenario of the role play card. And the next one is read the text and focus on the verbs. Okay, the verbs are the verb, all the verbs are mentioned in the task. Of task is there, and based on the verbs like suppose, for example, the verb is explain. So we know that it is for giving the information to the patient. And another verb is like elaborate, and it is also the information which we give to the patient. So like this, the verbs is very important in OET speaking, so please focus on the verbs. Next is anticipate how the patient might feel. Like in most of the cases, background history is mentioned, and in that point, the patient is having nervousness. We can ask, how are you feeling today? So that is a known case from the patient, these type of questions. So anticipate how the patient might feel. So these are the tips we can ask during the 3 minute preparation time for our OET speaking. So guys, I hope I have clear all these points regarding OET speaking, and these 3 minutes are very precious. Please don't skip even a second or waste or even a 1 second in this time, because it will very helpful for you in another 5 minutes to speak. If we can make all the points beforehand in our mind or write on a piece of paper, then it's easy for us to speak in front of the interlocutor. So thank you for watching my video. Thank you once again.